My name is Nefa-Tari Moore, and I am from Brooklyn, New York. In 2013, I had exhibited some abnormal bleeding that was outside of my regular monthly menstrual cycle. And at first, I didn't really think anything of it. So I didn't like seek, a doctor's attention or medical attention. It was just only after it had gone on for over a month into like the second, month or 2.5 months, and it started getting, heavier and heavier, and I also started having some lower back pain. And so at the time I was working in healthcare myself, and I just, I did have a sort of a big busy schedule. And so one day I woke up and I was really weak. I couldn't get myself out of the bed. And so my husband at the time, he said, "Well, you have to, this bleeding has been going on for far too long. You have to get yourself to see a doctor." So we ended up going to the ER, the emergency room. And at the emergency room, I wound up speaking to the ER doctor and explained to that doctor what I was going through in terms of the bleeding and the back pain. And at that time, I was told that, it was basically, outside, may have been like a change in cycle, or you know, because I was sort of was, I was busy, maybe busy schedule and different things, and the bodies had maybe reacts in a certain way towards stress. They did take an STD test and pregnancy test, and of course, they all came back. Everything came back negative, and so what they did is they wanted to send me home, with some ibuprofen and a doctor's note, and they suggested that I take, about a week or so off from work to rest. So I didn't think that that sounded normal, for a few different reasons. One being that this was outside of my regular monthly cycle, and everything about the bleeding was different than my monthly cycle whenever I would get it. And then also someone who's bleeding, you don't prescribe them with ibuprofen because it can have the tendency to cause more bleeding. So I pretty much pushed back and, said to them that I would like, further testing. And So we went on for there. I had to advocate for myself. And like I said, I didn't receive an initial diagnosis from there, but it took a lot of, advocating and speaking up for myself uh, at that moment. From there, I, you know, was, given an oncologist, and I was treated by the oncologist, had surgery later on during my second diagnosis of endometrial cancer. I had surgery, and then I was given a follow-up care appointment post surgery. And when I showed up to see the surgeon, and who was also my oncologist at the time, to, post-surgery appointment to see her. And I was told, once I got to the appointment for that surveillance appointment, I was told that that particular oncologist was no longer with the practice. In fact, before I was told that, when I arrived at the appointment, and I told them, who I was, my name and date of birth and everything, and who I was there to see. They were like, well, why are you here? Because, this doctor is no longer, she's not here. And they're like, who are you here to see? So it was just like, I was being, once again, not being heard, not being seen. So I had to like do something, to kind of like, I guess, open their eyes, something to grab their attention, for them to listen to me. So I had to like lift my shirt up to show them, the stitches, the metal plates that I had in my abdomen from the surgery that I had 10 days prior. And eventually I did get seen by a doctor who was there that day, after she had finished seeing all of her regular patients for the day. Then they brought me into the exam room and she examined me and removed my staples, but she wasn't too happy to, I guess, have me as a patient at that time, because she said to me, well, you're not, one of my patients. Why are you here? Just questions like that, that didn't make me feel too well, or even trusting at that point. And then she proceeded to remove the metal stitching that I had in my abdomen. Didn't give me any numbing medication. She just removed them, and the look on her face, she was just very displeased with having to do that. And I guess, again, as she stated, I wasn't one of her patients and they didn't understand while I was there. Again, I had to, advocate for myself. Once again, I felt like I had to, each time I was going, here's another appointment, another doctor that I have to feel like, I have to be on guard. I have to, go there and fight with someone, not physically, but, just to advocate for myself. And, not being seen as like, as the term that has been used for Black women, as someone who's a mad Black woman or aggressive, Black person. And so at that point, I didn't really care what, anyone thought. I just wanted to be said. I didn't feel good. Like I said, I just had surgery 10 days ago, for a second cancer diagnosis. Didn't know too much about what was going on. Oftentimes it's hard when you're, who's someone who looks like me, a black person, a black female, and it is, important not to say that, I only want to see doctors or trust doctors who are Black, but, you know just the way you're treated, and some of those disparities and pushbacks, or, you're not, being heard. And I felt in that moment that I wasn't being heard. So after, finding out that, the oncologist was no longer with the practice, I had to then go and find myself a new oncologist. And I did. And that oncologist, I still see her to this day. And this has been what, 5 years, over 5 years since my ovarian cancer diagnosis. And she is a Black woman, a Black oncologist. But not only, I feel comfortable with her, not only because she's Black, but because I feel like she has my best interests in mind. And also, she just makes me feel very comfortable. She listens to me. I just feel heard. I am the director of outreach for Black women at Share Cancer Support. And what we do there is we offer information to communities, the underserved communities, on the cancers that we serve, such as, breast cancer, uterine, cervical, and ovarian cancer. I love the work that I do, and I just love, advocating and helping other people, because this disease, ovarian cancer, has affected so many, different people, in many different ways, in particular, women who look like me. So I just want, to inspire other people, to let people know, how, to advocate for them, so that they can, advocate for themselves and ask the right questions, that, is, very important for their care.